you have to get the air right to get well, and also to cut down on malignancies. So ultimately, we'll have devices that'll test the air, and it'll be on your iPhone. So when you go in a place, you'll know whether it's, green, yellow, or red. Red means run, and yellow is it's not too good, and green will be it's okay. The problem with the numbers is the people that manufacture the products to measure numbers do not have any medical input. So they're just doing a cross section, a general average of the inside air compared to the outside air. And that has really nothing to do with human health. So the numbers on those instruments are too high for the kind of patients I see. 20% of the population cannot process mycotoxins. 80% can, but that doesn't mean it's used to stay in it. So the mycotoxins are excreted in the kidneys and in the urine. So if you're in there a long time, you have a higher incidence of bladder and kidney cancer. So we use HEPA air filtration, central dehumidification. It needs to be between 40 and 50%. Lower is not better because the sinuses don't function well below 40. You get too dry. And we do a central bipolar ionizer, and I'll show you that in a minute. And do Aprilaire 5000 filters, which are, they use electricity to decrease the particle count instead of, it puts less friction on the fan, basically, instead of having a really thick filter. And you can't have any fiberglass in the system. Fiberglass is like a cotton candy for fungus. So fungus grows all over fiberglass. And so when the fiberglass hits the sinus and mucosa, they have an intense eosinophil reaction. I'll show you what that looks like. This is the latest technology. That Israelis invented this thing. It's called a D6 stereonizer. It's self-cleaning, and all the rest of them aren't. So nobody's going to clean these things out anyway. So these are the electrodes, and what happens is it creates a trillion ions per second of positive and negative ions with no ozone and no hydroxyl. That's important. You can't have ozone or hydroxyl. And that removes mold, mycotoxins, VOCs, viruses, and bacteria from the air. So we put these in the central system and put fans. When you travel, you can take a fan with you with this thing in it. And this is the source to get those things. These two phone numbers, you can get those. And if you are interested, we'll come back to that slide in a minute. So the airborne mold spores and mycotoxins, MVOCs, enter through the nose and sinuses, go into the brain, lungs, and the entire system. And the sinus mucosa and brain has the highest concentration. And at the end, we'll show you, we can actually see it in the brain now by artificial intelligence software. And you can see it in the sinuses on a CT scan. So we want long-term wellness from chronic disease. So you got to clean the air first, get the water right, and the diet has to be right. So clean air is the most important thing. And we put them on a yeast diet with no sugar. You can have dairy, but you just don't want refined carbohydrates like bread, rice, potatoes, and sweets. So we put them on a protein, all your meats, all your seafoods, your vegetables, and your fruits or berries. And they can have, black rice and some of those things. You can't have chlorine in your water or you get overgrowth of fungus in your gut. Chlorine does not kill fungus. It kills bacteria. And then now this is, when you breathe, the chemicals go in the olfactory nerve and go right into the brain. And they also go through the bone here into the brain. So they're tiny particles. So they seem to congregate in these areas over here and in the cerebellar area. So this is what we do. We measure the particles count's got to be less than 50,000 at 0.3 microns per tenth of a cubic foot. And when you use a settling plate, just a SDA agar plate and put it out for an hour, the colony count needs to be 0 to 4 with 1 hour and 0 to 2 if they're severely ill. You can do a tap test, and the tap test is faster. It's going to have more colonies, so higher than 4 is going to be okay, but not higher than 7 or 8. Now, this is an example. This is two immediately post-op in the recovery room. This guy had eczema of his whole body, his face, arms, and everything. So this is 2 hours after endoscopic sinus surgery. His arms are clear and his face and neck are clear. That's very dramatic. Usually it takes longer than that. So, and this is one where this is this thing right here is a fungus ball. This white thing, this is a sinus x-ray. So all this should be black. All your maxillary sinus should be full of air. This is your eyes and this is your brain up here. So, and this is your airway. So all this is full of polyps. Can you see my pointer?
Yeah.
Yeah, okay. So this tissue removed is placed on an SDA agar plate. And in about 3 days, you get this brown halo around the tissue. Now, if you take the tissue and do a urine or mycotoxin levels on the tissue and on the halo, they both have the same mycotoxin. So the brown halo represents the mycotoxin leaching out into the media because it's got high osmotic pressure. So now we've done several hundred of these, so we don't have to test anymore. When you see the brown halo, it's mycotoxins coming out of the tissue. And that's why you get this dramatic result. So this is what she had. She had a heart transplant when she was 3 months old, and she's 25 now. So 25-year-old girl, this is her legs. And she has 4 dermatologists. This is the best they could get her legs with all the treatment. So once we cleaned her sinuses out, this is about 6 weeks later here. So if you show this to a dermatologist, they're going to jump up and down and tell you you're lying because they can't get this kind of result with all the treatment because they're not removing the cause of the rash. They're just treating the symptoms. So this is a hand, and the hand's clear, and it's the face is clear. So this is how all this works. So this is an antigen processing cell. This represents probably 20% of the population. And this is a T cell. So it's a genetic defect in the T cell receptor site. So this right here is where the T cell should dock between these two antigens, but instead it docks on the side, so it's unstable. And these are the binding sites. So it's like an autoimmune regulator. So this is 3,000 times the T cell activation. So normal is 0.01% of the T cells attached to the antigen. But in these people, 30% more are activated. So it's 3,000 times more T cell activation. And there are 3 interleukins, interleukin 5, 13, and interferon gamma. And when you multiply 3,000 times 3, you get 9,000 times the systemic inflammation per mole spore. That's why the air has to be so clean for these people. It causes systemic toxicity, and every system in the body is affected. So once you get this going, patients get allergic to everything. So when you're exposed to mold, they get multiple other allergies. And once you get them out of mold, all the other allergies are massively diminished if they're allergic to fungus. And this is the gene up here, 21q23.3. But this is what's happening. Let me just show. So what you just saw in that diagram, this is what this looks like endoscopically inside a sinus. All these red spots, these submucosal hemorrhages, are fiberglass particles that was carrying fungus. into the nose. So these eosinophils have come and destroy the cilia on top of there. So then the mucus can't be moved. It poos and it gets infected. And some of them, there's two groups. Sometimes it affects the lungs the same way, and that they have really serious problems. But most of them don't have lung issues. It's mainly in the sinuses. And then this is more severe. All this is fiberglass in the duct system. It's very common in Florida. Almost all the places have ducts lined with fiberglass. So 80% of the population doesn't react, but these people who are on oxygen at home and end-stage lung disease that never were smokers, it's usually fiberglass. And they have this issue, they have this genetic predisposition. So the eosinophils keep coming in to the extent that they dissolved all the mucosa around this spot down to bone. So underneath this scab is bone in the posterior wall of the maxillary sinus. And that takes about 2 or 3 months to heal once they get out of it. So this is the attic. So there's a blown-in fiberglass, and see all these particles in there. So it has to be batted and covered with plastic, because if you have air ducts in the attic, they're not 100% airtight. So this stuff gets sucked into them by the Venturi effect when there's airflow through the duct, and then it goes into the house. This is all candida in the endoscopic exam. So candida is caused by fungal exposure and a bad diet. But you can't remove this with antibiotics. We have to use antifungals in here. So if you use amphotericin nose spray or nebulization, all of this stuff goes away in a few weeks. And then this whole biofilm is gone. This is how it looks after all this. This is how it looked before, and this is how it looked after this. So this is the mole counts inside a house where this patient lived. And so they've got all this inflammation in the sinuses because they're breathing fungus. So then they get a big candida infection inside the sinus. This all this white says it's candida. Then we want to get the house clear. So you got 0 to 2 colonies here. This white here is light reflex, but all of this on the mucosa is normal, and all this candida is gone just because we got rid of the airborne fungus. And this is a big fungus ball inside the sphenoid sinus. That white thing indicates it's a fungus because they secrete calcium salts when they metabolize food. So when you see white spots in a density, that usually means it's a fungus. And this is the airborne counts inside the house. And this is in the nose. So this is that aspergillus 2 numerous account and penicillium in the nose. And then this is the house. So if this person doesn't fix the house, since they go back home, this is right back the next day. So you got to fix the house. And this is a patient who was actually allergic to all the azoles. The only one she could take was amphotericin. So we cleaned this out. This was going down to her lungs, and she had a big mass in her lungs, and it was growing because it's aspergillus here. So all this stuff here is aspergillus. Once you take it out, it's clear here, and this is all aspergillus. It's dissolving the bone between the brain and the sinus. So it's making its way into the brain, but we got cleaned out before it did that. So once you get this cleaned out, she still had the lung problem. So she had a pulmonologist that was from Harvard, and I called him, and most of those guys won't listen to anything, but this guy actually listened. So I told him, look at Hopkins. We used to, when we bronchoscope these people, we would put amphotericin at 3 milligrams per 30 cc's in water and put 2 cc's in each bronchus and suck it out. As soon as you put amphotericin in there, the hyphae retract and you can suck it out of the bronchus. But without amphotericin, you can't ever get it out of the lungs or the sinuses. So amphotericin is a magic thing. And so their brain gets better too when you irrigate them with amphotericin. This is an example. Patient had brain fog after getting exposed on an airline it got a mold exposure. This is what she said.
This is patient Linda Stanley with this notice of vertigo and cognitive dysfunction. Can you tell me what happened to you?
I was on an airplane on Thursday, flying 2 times that day, and later that night, early the next morning, started feeling dizzy, vertigo, fuzzy head, impact on my sinuses.
And then what happened to clear it up?
For today, when you did this procedure,
With amphotericin into the sinus.
it immediately cleared my head. No more vertigo, no more fuzzy thinking. My sinuses opened immediately.
See, now that's hard to believe it happens that fast, but this is what it looks like when she had surgery, so she had an opening in her sinus. So this is what we put a blunt needle and just squirt amphotericin inside the maxillary sinus. So you're looking inside the maxillary sinus right here, and this is amphotericin we're putting in the sinus. We just fill the sinus up with it, and then that causes release of all the hyphae, and then you get this result. And most people get improvement in cognition when you do this. So when you do it and inhale it in the nose, most people get better. Now, I wanted to prove, she was talking about how her fuzzy thinking went away. I wanted to prove how that worked instead of being, just somebody's talking about it. So we did a QEEG on these people, and all of them have these red brains. So red indicates disorganized thought process that's high voltage, and normal would be green and yellow. So this is after we treated this patient with amphotericin and diflucan in this person. All this red clears up. Now they got to be out of the environment, and their diet's got to be right, or you can't get this kind of result. But this is what that patient's brain would look like after the amphotericin went in. It changes pretty dramatically with a QEEG. And then this is a hearing test called a P300. It means it takes 300 milliseconds for the sound to get from the eardrum to the brain. And when it hits the brain, the red and the green line cross, and that should be at 400 milliseconds. 300 milliseconds, excuse me. So this one was 416 milliseconds. It's longer. And this one, they never cross. So I noticed in the clinic that when you're talking to these people, nothing's happening upstairs. So I make them write it down, what I'm telling them, or else they're not going to have good cognition and retention of what you're telling them unless they write it down. Then they own it. I was just wondering why they all had problems, so I just proved why they had it. They got it's a delay for the sound to get to their brain, so they're behind what you're talking about. And so this is a patient that she didn't want a picture to be shown, but this is her sinuses. She didn't have really bad sinuses, but she had this. And when we took this out, this tissue here had aflatoxin and ochratoxin in the tissue. And the brown, we assayed the brown, and the brown had the same mycotoxins leaching out of the tissue into the SDA agar here. So this is what she had to say.
My symptoms were suicidal depression as well as anxiety. My treatment was numerous SSRIs, tricyclic antidepressant, as well as SNRIs. I also received just under 20 electroconvulsive therapies to my brain to help to treat depression. I also was institutionalized for my condition, and I was considered to be treatment resistant. I recently just had sinus surgery with Dr. Dennis, and it has completely revolutionized my psychiatric condition. I am no longer experiencing any depression, nor am I experiencing the extreme anxiety. I feel as if he has saved my life, and I am no longer on any psychiatric meds. It is a complete miracle. Thank you, Dr. Dennis.
So that's why we all do this kind of work. So that's a dramatic outcome. And this is the same patient. This is a QEEG diagram. The red is disorganized thought processes, and this is the way she was pre-op. The next one is after surgery. She's much better, but she still has some red in here. And then this is after neurotherapy. You got to complete them with neurotherapy to get the rest out. See, this is all clear now. And that's passive neurotherapy, and they can do it at home on the computer, or they can have somebody help them with it. This is another example of the same thing. Tissue, brown halo, it's all the mycotoxins are coming out of the halo. And this is that little white speck in that polyp means it's fungus. Fungus secrete calcium salts from the metabolized food. So when you see this little polyp in there, see that little white dot, it's most likely proves it's going to be a fungus. And so when you take it out, you can grow out fungus. Sometimes on a plate, just depends. So this is what you clean out, all this stuff. And all these air cells are removed. They're real thin. They just suck out. And then you got one space so you can irrigate your own sinuses out after that. That's the benefit. So this is the tissue that we took out, and this is that same tissue. This just shows this is a known, this patient had negative urine mycotoxins to show that all tissue doesn't do this. So this is a sinus case without the mycotoxins. So if you don't have mycotoxins in your urine, you don't have a brown halo around the tissue you take out. So that's a control. And this is the cyclone that makes this possible to irrigate. This is an example of what it looks like. So this is the frontal sinus here on a mannequin. And so you see why this instrument is so powerful. It's not, you actually push it a lot harder than that. But it sucks while you're doing it. And then we'll show you this a little bit. That's how fast it sucks. That's important because it gets all the toxins out of the way when you're washing them out. And then you put a lot of pressure on this. You really bear down on it, and it really cleans every millimeter of the mucosa when you do that. So this is a before and after. This is what this patient looked like, and this is like a month later. A massive change in the way she looks. Now this guy, this is what he had to say.
This is 3 weeks post-op. What did you experience?
Well, before my surgery, I had a bunch of floaters floating around my eyes, and my vision was, pretty blurry and sort of discolored. And post-surgery, my floaters are gone and my vision has gotten a lot clearer. My energy level is now a 7 instead of a 3 before surgery, and my brain function was a 3 and now it's a 7 and gradually getting better.
Thank you.
All right, so, and this is another, so this, you can see all this stuff in there. He's got the white stuff in there. These are air bubbles. So these are live organisms in there making air, just like people do. And so this all should be black like down here. So this was a big fungus ball in here. And after we got that out, he had an interesting experience.
Hi, I'm Robert Taylor. I'm a patient of Dr. Dennis. I had surgery yesterday to clear my sinuses out, remove some polyps. What I want to probably say first is how I felt before, which is very difficult because I could not explain how I felt before. All I can say to describe my feelings, I was in this constant state of fight and flight. My cortisol levels always seemed to be through the roof, and my body always seemed to be on fire, always in a state of anxiousness. Had my surgery yesterday, and within a matter of a few hours, I felt this life-changing transformation where I almost felt like my brain had been inflamed before, and that inflammation subsided in a matter of moments. I almost felt like having a tumor resting somewhere and that tumor being removed. I had a level of clarity, a level of euphoria that I've not experienced for many, many years. In fact, my wife, who was not in the room, had asked whether she'd given me the anti-anxiety medication because I felt it was the medication that had given me that euphoric feeling, which it was not because I had not taken it. And the transformation is beyond words. And all I could think of and kept saying was that Dr. Dennis saved my life because I was heading on a path that I felt totally out of control and had no idea what was wrong with me.
He was a pilot and an attorney, and so he couldn't do his job and with all these mycotoxins. So they've got the MTHFR gene, and he can't methylate B12, so he can't excrete these toxins that are in his brain as fast as most people can. So that's why he was having difficulty. And that's about 20% of the population. It can be more or less, but that's a rough estimate. Now, this guy had a hearing loss in the left ear for 10 years. And the reason is he was in a toxic mold situation a long time. All this gray stuff in the right max ethmoid sinus is polyps. And the polyps are an immune reaction to fungus. So when you see polyps, that means they got a fungal exposure. And so we cleaned all this out, and this tissue looks like this on a mold plate. See all this brown halo around here? That's the mycotoxin. So the same mycotoxin, he had 4 mycotoxins in that tissue, and the same ones are in the halo around the tissue. So this is his experience.
I would guess that I've been brought out of anesthesia for about 20 minutes now. The first thing I noticed as I came to is my hearing is improved drastically. I can hear the conversations in the room next to me. I'm still trying to determine if the tinnitus is completely gone or just mostly gone. The ringing is obsolete in my ears. I haven't been able to hear this well for at least 10 years.
So if you told me the guy could get his hearing back after 10 years, I would have bet large money against that. So I've never seen that before. So this is really dramatic. This is important because most of these, at least over half of these people, have damage to the pituitary. And it commonly is going to be thyroid, cortisol, growth hormone, and some of the sex hormones, and any combination. So the problem is the IGF-1 level is not accurate in terms of measuring your growth hormone. So you can't rely on that number. So we did a study on a bunch of patients. We found out that if they have an IGF-1 higher than the mean of normal, then they have a 53% chance they're growth hormone deficient. They can't make their own growth hormone, and they have to have injectable. So all these people all their hormones should be measured, and they should work up your growth hormone and stimulate to make sure they can really make it. And we had one that had 285, and the high normal was lower than that, and yet they had growth hormone deficiency. So this is a big blank spot in endocrinology where they are relying on the IGF-1 level and not really testing the patient and listening to the patient, see what their symptoms are. So this is the range of the patients we saw that cannot make growth hormone after tested were 43 to 285. Well, 285 is higher than the normal range, is what I was talking to you about. And 43, and in no situation is a double-digit normal, but most labs have a double-digit as being normal. That's like saying one leg is normal because you can still hop. It's that bad. So you got to listen to the patient and work them up and make sure they can make their growth hormone. So it's really important. Now, this is a guy, he had Parkinson's in the left arm and left leg.
Mr. Baker, 6/25/18, left tremor of the arm and some leg tremor as well.
And this is him post-op.
This is after treatment of mycotoxicosis.
So, and this patient had another patient with Parkinson's.
This is patient Mark Anderson on 1/16/24. He's got tremors in both hands and both legs.
Now that's the best he could get.
Mark Anderson
That's the best he could get with maximum medication. And this is him now.
post-op 3 weeks.
So it's dramatic when you remove the cause of the problem. So, and this is his mold plates. See, his house was really bad. We wanted 0 to 4. These are all high, and all these plates are high. And this is what came out of his sinuses. See how much huge amount of mycotoxin, that brown stuff going into the media, coming out of that tissue. So this guy was in a wheelchair for 2 years, couldn't walk because he was in a moldy house. He did everything to the house known to man, and nothing worked. So he actually couldn't live in that geographical area. So
This is Tim Green. Fibromyalgia, muscle weakness. Now go backwards and then sit in the chair.
So he was like that for 2 years. And then after he did everything known to man, I just told him, you got to go to the beach. And he did got a new place on the beach. And that's what it looks like after that.
Hi, I'm Tim Green. I'm now living on the coast of North Carolina, and I'm living right here on the water, where there's no grass, no trees, just the breeze off the ocean, and I'm doing so much better. My health is tremendously better now because I'm living where there's a 0 mold count. That's made all the difference in the world in my health. I had severe headaches. I was in a wheelchair for over 2 years, living in the mountains of North Carolina where it rained all the time and there was mold and trees everywhere. But now living here where there's a 0 mold count, I'm healthy, I'm walking again, and praise God, life is good. Thank you, Dr. Dennis.
So this patient lived in a trailer, and cat died and got leg paralysis just like the patient did. And then we got her out of the trailer and gave her antifungal. She didn't need surgery, but this is what happened to her.
This is Jennifer Parrish, who had severe mold exposure in a trailer and has trouble walking. She has paralyzed left leg and inability to evacuate her bladder or bowels. And she's had 3 episodes of this after living in a trailer where her cat died and got leg paralysis as well from the mycotoxins.
So this is her about 6 weeks later. Got out and did all the usual treatment.
Jennifer Parrish on 1/14/08. Patient had right eye paralysis and right eye blindness. Now she can look all the way to her nose, and she couldn't do that before. She had left leg paralysis. Stand up for me. She can walk easily. Back that way. With her left leg, she can support her weight on the left leg. Lift up your right leg. Lift up your left leg. So she's got all her strength back, and her neurogenic bladder is over, so she can urinate properly. And she had a mass around her spine, which has gone away. This is all on Sporanox and vitamin supplementation, and her vision's coming back while they're chelating her for heavy metal.
Okay, this is important because you see how quickly somebody can get sick again. So this is a guy has a hard time walking. This is the best he can do, walking. He can't pick his legs up. This is after I got through with him. All right, so in this, he comes back a month later and gets a moldy rental car at the airport. And within 30 minutes, he's almost as bad as he was before. So the point is, you can't get back into fungus. That's the problem. Now, this is important. This is a new technology, artificial intelligence software that allows you to see the mycotoxins on CT scans and MRI scans. So what we did is took this AI technology that's used by the Defense Department to see enemy submarines from satellite data under the water wherever they are. So we always know where all their submarines are. So when he told me that, I took all the mycotoxins in glass vials from the lab, and we CT scanned the vials and MRI scanned the vials, and we looked to see what algorithm shows something in that test tube. So we found we take the patient's urine and whatever mycotoxin they have in the urine, we use that algorithm. So this patient had gliotoxin in the urine. So his test tube of gliotoxin shows it's a black substance. So then we do the the CT scan. This black stuff is gliotoxin. We biopsied this site before after surgery, and then we found the same mycotoxin in that tissue. So the test is accurate and is confirmed by biopsy and tissue assay. So that's going to change everything. So this is the tissue, and this is the mycotoxins coming out of the tissue. Now this is the patient who had severe headaches daily, migraine headaches. He had a colloid cyst in the left ventricle of his brain causing that, but you can't take a cyst out there. They won't survive a surgery. So we took the gliotoxin, and if you do an MRI of the gliotoxin, it's a white substance, it looks like water. But when you run the algorithm for gliotoxin, this particular algorithm's got red spots and blue. You find out that this stuff in his colloid cyst is actually gliotoxin, and the body surrounded it with a casing to protect the brain. And that's what caused the cyst. So then you see this MRI, all you see is these white spots. At the junction of the gray and white matter, the vessel's the smallest, so you get infarcts there easier. But she's got more than that. So she had gliotoxin too. So this is what gliotoxin shows up in the brain, how much more toxin is there than you can see in the MRI scan. And she got all this cleared up. Now, this is the most important one. This is a test tube of gliotoxin. This patient had a tumor in the pituitary gland secreting large amounts of cortisol. So she had a 114-pound weight gain in about 3 months, and she was not going to make it several more months without, dying. So as soon as I saw her, and she told me about the weight gain, and she was a yoga instructor, and her diet was right, I sent her to the endocrinologist and told her she had Cushing's disease, find it and let's fix it. So he found the tumor, and the neurosurgeon took the tumor out through the nose. Then we got a piece of the tumor, and we did 2 assays back to back to prove it was right. And there were 11 mycotoxins in this tumor right here. So after we took took the tumor out, and treated her for the mycotoxins, this is the list of mycotoxins we did it twice to prove it was correct. So all these mycotoxins were in that tumor, which was causing the tumor. So this hadn't been published yet, but a lot of pituitary tumors are commonly recurring because I think it's an environmental illness. We figured that out. But this is her before, when I first saw her, and this is her now afterward. So this is a dramatic change. And this is a positive CAT scan. It's got a bunch of polyps in here, and this is a polyp in here. So all this black stuff, this is a trichothecene and gliotoxin, is mycotoxins in the sinuses. Now, this guy has a huge pituitary tumor, and he's needing surgery, but he doesn't want surgery. So he's also got trichothecene and gliotoxin. But see, this is a huge tumor, and this is the internal carotid artery right here. So this is the pituitary gland, and this is the optic nerve crossing at the optic chiasm right above the pituitary, and this is the left internal carotid artery, and this is the airway. So if you look at, this is the cadaver here. So if you look at this tumor is all the way down, encroaching on that airway and smashing the internal carotid artery. See right here. So this is him. So his brain, this MRI scan doesn't show anything, but the AI technology shows he's got mycotoxins in his brain. And this is after we treated him without surgery and got a lot of it out. Some of it's migrated down here, but it's continuing to go away. So, and I'll show you what we use to do that. Oxygen is really key. You got to use oxygen for a couple of hours a day at 100%, 10 liters a minute or 8 liters a minute. And this is that black stuff is usually air, but this is the test tube of the mycotoxin, and we ran this algorithm on it. So, and this is air up here, but you can see this material here, and there's some black material here. This may represent the first ability to see VOCs in the sinuses. So it's just ongoing research here. So what do we know? We know when one mycotoxin is present in the urine, 10 or more are present in the brain. So if you got it in your urine, it's already in your brain. You don't have to image it to see it, but imaging is nice. And some pituitaries are likely caused by mycotoxins since they're found in pituitary tumors in high concentrations and are known to be tumorigenic. Pituitary tumors have a high recurrence rate. So airborne mycotoxins enter through the nose and randomly distributed through areas of the brain. And they can be removed from the brain with a combination of environmental, medical, and when indicated, endoscopic surgical techniques and using amputation with vorconazole with a cyclone and irrigation. And in the office, we try to get the patients out of the environment and doing things correctly before I ever see them, so they're going to contaminate the whole office too. So if we have one slip through the cracks, this is a Microbalance has these, is a company that has these foggers that you put EC3 in it. We'll tell you about that later. But anyway, you fog the patient in the gown, and this is what it looks like, fogging. And this is what fogging the patient looks like. So when you breathe this stuff, it actually makes you feel better. You can drink it. It's non-toxic, but it's just, it does get rid of mycotoxins and fungi on the clothing, so you can actually see the patient. This is another example of fogging. You actually have to pick this up and move it around to fog something. So this is the differential. Greater than 90% of fungal load occurs in the air on the belongings. So we take a history and do mold plates. And if it's 0 to 2, it's what we want. But we do a tap test. Front loader washers are notoriously bad. Some of the BMWs, not all of them, they save the water inside the air conditioning system. Sometimes some of them don't have a vent for the water to get out. All animals, if you tap test animals, they're full of fungus normally. That's their normal nature. So these patients, like we said, react 9 times sometimes normal. So you got to get the colony count down, or all medical and surgical treatment fail. They'll just keep coming back and nothing will ever work. So you got to have the diet. You got to get on a Candida diet. Now, Candida has a sugar receptor on the cell wall. So when you feed it sugar, it changes from the yeast form to the invasive hyphae form. The hyphae are 3 feet long, and they go down into the tissue to feed, and you can't suck that out of a sinus unless you put an antifungal on it to make it retract the hyphae. And when you cheat on the diet, you think it's resistant to all the drugs, but it's really not. It's that you can't kill it with anything when it's in the hyphal form. It's drug resistant because of the diet. And you got to address the pituitary gland. You got to really look at that to get these people well. And all of them immune suppressed. So especially the ones that had the vaccine, they got double. They get Epstein-Barr cytomegalovirus, Lyme's, and herpes, and heavy metals, and MTHFR. And then cancer's rare, but that's the differential. We only see that in single-digit percentage. So get the patient to a mold-free environment and remove mold from the nose and the body. If you clean the nose and clean the home and the clothes, they get better, basically. So this is the summary of what we do. You got the lower air content. We use HEPA filters, EC3 fogging, and EC3 laundry, and saline nose washes with citral drops, amphotericin nebulization. And we knock out the yeast first with dofecan and nystatin and a probiotic, and then we switch them to itraconazole and put them on there for a few months. But none of this stuff is helpful unless you get them out of the environment first, because you're breathing not 1,800 but 3,000 gallons of air a day, and you can't beat 3,000 gallons of air washing your nose out with 8 ounces twice a day. So it's like trying to dry off while in the shower. Nothing's going to happen. I'd say 80% of these people have GERD. So we treat the GERD and work them up, make sure they don't have a mechanical cause of GERD. The vitamin D levels need to be between 80 and 90. Most of them have low vitamin D levels. And we use VSL as a probiotic. You can use whatever you want, but you need 1 billion units per capsule. That's the magic number. And then we do an ALCAT test for food allergies on some of them. So we use colostrum too. And then you got to do a total pituitary workup. And you can use binders. I like the simple ones that diatomaceous earth and zeolites are okay, but most of the time I don't need these. Bentonite clay and cholestyramine, I never use that stuff, but I'm not against any of it. It's just most of the time I just need light stuff for what I do, and they get better. So the diet's really important. And so this is what we started on, like we said before. These are the main ones. Probably the best one of all is voriconazole, but it's more expensive. Voriconazole gets in the brain better than Sporanox does. So we first start getting rid of all the yeast. Now, I keep them on as nystatin long term. It stays in the gut, doesn't go to the liver, doesn't interfere with any other antifungal, but dofecan does. So I stopped that in about 2 months, and then we probably started on Sporanox, just depending on the individual. These down here don't do much, in my opinion. I tried them all. So remove the antigen, which is the fungus. and control the air, and they get better. You got to get the fungal load down, and we irrigate with normal saline, do antifungals, antibiotic sprays, and oral antibiotics. Occasionally we need those, but most of the time, if I put them directly into the sinuses, they do actually better than oral antibiotics. Sometimes you need an oral, but most of the time we don't. If you give them oral, you got to give them nystatin and a probiotic every time, or twice a day, or they get in trouble. So immunotherapy for IgE and IgG specific molds is helpful. And then MRV is mixed respiratory virus. That's strep, staph, diplococcus, pneumococcus, and Haemophilus in a vaccine. And a lot of these sinus patients are sensitive to all those. So we desensitize them with very minimal concentrations of this stuff. Yeah, some of them, I'd say half of them or so need endoscopic sinus surgery. And the ones that will not do the environmental piece, I guarantee them 100% failure rate. But what's strange is they still want it done. So this is the website. If you want to copy that down, microbalancehealthproducts.com. Dr. Dennis, that's all the stuff that I do for the patients, what I give them. And the other way to get to is sinus5.com. But this is my little protocol up here. And sinusitis wellness is mostly articles and patient education. And then we get down here. Now, we're finished with the formal thing. You want to have some questions and then go
Yeah, we
to
can
the other
do
stuff.
questions and then we'll go to the other stuff.
Yeah.
So Steve asked, can mycotoxins get into the inner ear area and cause hearing loss? So I guess you already answered that
Oh,
one,
yeah.
right?
They cause vertigo too. Severe dizziness is common. You got to get it out of the air before you can get it out of the patient. So everybody starts focusing on the patient and doesn't pay attention to their house, and you're not going to get anywhere. You gotta. That's like trying to dry off in the shower. It's so much volume. You're breathing 3,000 gallons of air a day, and so you can't combat that with a few pills. That's not going to work.
Dr. Dennis,
Yeah.
thank you very much for this lecture. I think you should give this lecture to biologists and immunologists. Have you done any presentation for the Quad AI or ACAI or any of that's one small question, but I have a question for you.
No, but I'd like to.
Yeah, I think that would be really great because this is what we treat. Every day we see sinusitis, and most people don't realize how much mycotoxins contribute to this sinusitis. I do exactly what you're doing, but I think I'm under treating. I do diflucan, give them an antibiotic combination with diflucan to try to get the candida out of their noses. But the major issue I have is we see more and more of eosinophilic asthma. And they're using biologics to treat the eosinophilic asthma. There's a reason why the eosinophils appear in the lungs. Could it be simply because of the candida or the yeast? I mean, all of those fungus growing in the lungs or from the nose to the lungs that is driving the eosinophils to be present, and now we just kill them off.
So you remember the picture I showed you of the sinuses? Let's see. I'll just okay. See this?
Right.
These are all eosinophils. This is inside the sinuses. It dissolved all the mucosa down to bone here. This is the same reaction that is in the lungs. So you can have somebody who has no sinus trouble, has only lung trouble, or they have both.
Right.
or one or the other. If they have lung trouble and the eosinophil count is high, it's more likely than anything that they're in a fungus environment.
Yeah,
So you got to get to the environment. They got to fix the environment. That's the hardest part for them, or you're not going to get anywhere. Long term, you can help them, but it's minute help. It's not because they're breathing 3,000 gallons of air a day, and they're reacting like you're looking at this picture. That's an intense reaction. Well, you can block it with steroids, and you can give them Dupixent. And yes, that does work. It stops the immune reaction, but they're still full of mycotoxins. We
correct.
haven't done anything about that.
Right.
And the mycotoxins are in the brain, and they totally destroy the brain. So the cognition's down in most of these people, and energy levels down. I just ask them those two things. What's your score, 1 to 10? Your cognition is 10 normal, and what's your energy score? And that's how you can score their pituitary gland and how much there is in their brain. They're pretty accurate with their description of what their energy level is, and then what all the neurological symptoms are, especially, they having hearing loss, ringing in the ear, vertigo. All that is common with fungal exposure. So
The treatment, in terms of a treatment with the antifungals, how long would you say would be optimal? You said months?
well, okay, let's go back to the environment first. Let's say they're still in a moldy environment. You can give them a truckload of antifungals for 100 years. It's not going to work. You'll knock their liver out before you do anything. So yes, it will knock it back. It will help them. But if they're still in it, you're not going to have a long-term result. And then you risk getting resistant strains of fungi because you can't kill them, because she's breathing more than you're killing, basically. So I give them probably 2 or 3 months worth of the stuff, but I really don't start heavy doses of that till I get them in a safe environment, because I'm kind of wasting it. You're putting pressure on the liver, for one thing, for no reward when you do that. So there's 2 companies that I use and trained on the human health side how to do things. And a lot of the remediation companies get taught by people who have no training in human health, and they do a lot of things correctly, but they all do some things that are not right and don't get the ball across the goal line. So the solution to that, I don't know, but this ionizer is really helpful, getting the colony counts down. And yes, give them antifungals, and get them on the right diet. If you get the air right and the diet right, everything you do is going to work 10 times better. And you'll get really good results, unless they've got a lot of stuff hung up in their sinuses and they need surgery. Half of them need surgery, half of them don't. You can help all of them to some extent.
Do you give courses to other ENT physicians? Because many times the patients have had multiple sinus surgeries, and they still have a recurrent sinusitis requiring surgeries, and they keep on doing the surgeries without the appropriate treatment. So
the problem is it's hard to get physicians of any specialty involved in getting the patient's environment straightened out, because they don't have access to who is the right person to get to do it, because getting it done wrong is a bad thing too, because you waste a lot of money and you don't get the ball across the goal line. So it's an environmental illness, and what really needs to happen is universal environmental health training and how to do things correctly. That's what's really missing. Now, I'm not saying there's no company that does it right. I just hadn't seen one yet.
right.
So I know that's the hardest part, because we're in medicine. We're not environmentalists, I had to get that way to get anybody better, and learn all about it. But to get a doctor to get involved environmentally is not going to happen. unless they're kind of unusual. But even if they could just move out into some place that they know they're getting better in, that's a big step. And then get this ion fan I showed you, because it makes 1 trillion ions per second, and it removes mold, mycotoxins, and VOCs from the air, not the contents. But if you got 6 feet of water in the basement, that's not going to help you. So, you got to do the best you can. But yes, all the things you're doing are important. They're worthy, but focus on the nose. They need to irrigate their nose out with distilled water and a saline irrigation. And we put citral drops in there, which is one of the things that we use on our website. Or you can put SSKI, supersaturated potassium iodine drops in there when they're infected. Do that, and then there's this thing called a Rhino Sprint, RINO Sprint. It's a small nebulization device just for the nose. It does 1 nostril at a time. So you put 2 cc's of amphotericin in there, and amphotericin is mixed at 3 milligrams per 30 cc's of water, not saline. It won't work in saline. And so voriconazole is mixed with 12.5 milligrams and 30 cc's of water.
Oh, distilled water, because
Yeah, water.
yes.
So, that's right, not tap water.
Not that water, yeah, because
Distilled
distilled
water.
water. Yep.
That water is full of chlorine, and so now you just do the math. If you're going to do a liter, just do the math and see how much you got to put in there to equal that. And but those 2 things, if you do one or the other, voriconazole, amphotericin, have them irrigate with that. And you can also use voriconazole in a nebulization, and so you irrigate first and then you nebulize, and do that twice a day. That helps more than any other pill on the planet for the sinus part. So what people do is they give them antibiotics with no yeast protection. And so they're overgrown with yeast to start with, and the gliotoxin is high in their urine because of the yeast. And so you don't want to, you always give them nystatin twice a day, and VSL Flora with any antibiotic orally. And if you put the antibiotic in the nose, you're going to have a better result than in the mouth. If you irrigate with it and then nebulize with it twice a day.
Yeah, that's interesting, because I know SSKI, potassium iodide, actually kills fungus.
That's right.
The toenail fungus and stuff like that. But I didn't know you could do in the nose. So that's really
Now
nice.
you mix it with saline now. Don't just do it. Don't do it straight. You know that.
Right. Yes, of course.
So we put 8 to 10 drops per 8 ounces of saline. And you can amp it up or down, but just depends on if it have any symptoms from it. But that really works well, and citral drops work well too. So we wash out with that first, and you can even put there's this thing called microchitosan. I don't know if you know about that. Microchitosan is shrimp hulls powdered in capsules, and that's on our website too. But you can add that to the salt water, and it's a natural antifungal, and you can't OD on it, And so you put that in the nose, and we give them 2 to 3 capsules twice a day, and that really helps decrease polyp formation and inflammation in the nose. Microchitosan. Actually, the Japanese did figure that out.
Great. Thank you so much for this. It's nice.
You're welcome.
Thank you, Dr. Dennis. A couple more questions. We're back to the mycoplasma, mycotoxins in the inner ear. Can that cause a dark black phlegm?
Yeah, but usually the black phlegm is fungus itself, and that's kind of common too. When you see black phlegm, it's usually Aspergillus penicillium group of organisms, and yes, mycotoxins are definitely in all that stuff, but they usually don't have a black color usually. But if you see black stuff, it's usually going to be fungus.
Okay. I almost hate to ask this next question, but I'm sure you've heard it before. Dr. Andrew Campbell states that blood testing is the only true way to go, and he feels urine testing is little value.
Yeah, there's a debate about that. I know Andrew, he's a good guy. The problem is you don't have a temporal relationship when you do IgG and IgE. You don't know whether they have it right now or it was before, The urine is pretty good. I like the urine better because of that. I want to know what's happening right now. Are they peeing it out right now, And
Yeah,
so,
my understanding is that the urine tests are newer, fresher infection. It's a 1 to 3 day infectious versus a longer term for the IgG and the IgA. I think is what he's measuring, or IgM.
yeah. I mean, I don't have anything against that. It's just if I got to pick one or the other and not both, I'm going to do the urine because I know it's happening right now in the patient's environment. I know that for sure. I'm not sure it was last month or 3 months ago or whatever with the blood test, but they've been exposed by the blood test.
Right.
You just know. Now, what I do to sort of cap all that, I just take a mold plate and tap their clothing with it. I know right then how their air is now. That's more important, because if they're growing out a bunch of mold on the plate, it's going to be mycotoxins everywhere. But here's the thing. You can have a house that they remediate correctly. The best guys have done it. Everything's done correctly. And the patient still can't inhabit the house. Why? Because the mycotoxins are small particles that float on dust particles, and they act like a gas. They go into sheetrock, not on top of. They're on top of it too, but go into the wood and into the sheetrock. So you can do a house perfectly and get everything out of there. You got zero mold counts, everything looks good. And then that stuff is leaching out of this. Think of it like this. You have a house fire, put it out, you take everything out of the house. There's nothing in the house. You clean everything, you go back in, you smell smoke. It's like the smoke. It's in everything. It's penetrated everything, but you don't smell it. And it leaches out over time. I used to not believe that, but I got this one patient, he did everything right to his house, and it didn't matter what I did, it didn't work. So I said, okay, what have you got from the moldy place in your new place? He says, I took my desk with me, but I took it outside, and we two times we vigorously took all the drawers out. We cleaned it, we scrubbed every inch of it twice, and we dried it. We brought it back in. I said, I don't care, just humor me. Just get it out of there, see what happens. He got well when he took it out of there. My point is, it's into the wood, not on top of the wood. And it leaches out later on. Now, some people, they get their house fixed, they're fine, they can live in it, no problem. But let's say you got a guy who's in a wheelchair, and he doesn't know his name, okay? Don't stay in the house. Don't waste any money on the house. I'm not opposed to fixing the house, but get out of it into a safe place so you're getting better. If you want to then address the house, do so and be open-minded. When you go back in, if you start feeling bad, you're done. You can't go in there ever, That's the way you have to treat it seriously because it's your brain. And you only get one of them. So you don't want to destroy it, worrying about the house.
Right. Would light, LIGHT nasal probes be useful? And if so, what wavelengths?
Light nasal probes?
Yeah, I think, like red light therapy or blue light therapy, something like that.
It might be helpful. I don't know exactly how it works or what it does, but I know that it's helpful in a lot of things. You can try it. It's not going to be the answer to anything. It might make them better, but you got to get the organisms out of the sinuses. And the only way you're going to do that is to get it out of the air, because you got to stop breathing it. So I've had patients that have done everything right and they've had surgery and they go back home and they come back for their post-op cleanouts and their sinuses are already full of polyps again, And so I said, okay, you have to find the source of your fungus, or nothing's going to help you. And so usually they'll start digging it. It's their car, it's their washing machine, it's something they overlooked. Once they discover it and get it out of there, then they get well. So I'm just saying, you can block the immune reaction to it with Duplicin, but they're still going to get poisoned by the mycotoxins. You see what I mean? So long term, that's not an answer.
I know that one of the first ones I ever caught was a lady who was fine in the winter, and then she would be sick every summer. And we eventually got around to testing her for mold because it wasn't on our radar for a long time, and it was in the air conditioning duct in her car.
Yeah,
so
that's
in the winter, air conditioner wasn't.
I had that happen to me. I dumped the car as soon as I figured it out.
Yeah, and then I have about 8 patients. They worked in a government building in Northern California, not too far from here, and every one of them is positive for mold. And they've all gotten sick within the last year. And of course, the powers that be said it's not from the building, even though they closed it up and moved them all out. So
you got it. The building. Some of those buildings just need to be torn down. There's some are so bad you can't fix them, and you have to have somebody with a brain fix them, and that's not going to likely happen unless they understand what you're supposed to be doing. It's a mold issue, and you got to have professionals that know what they're doing to address it. You can't just go in there and change the filters and have some guy scrub the ducts out. That's not going to work.
Does the MRI imaging for mycotoxins require contrast?
No. Whether you have contrast or you don't have contrast, you can still see it. But now here's the problem. The company that put this software out and I used it and developed this, they're right now selling the company. So I can't get this done right now. The only way this is going to happen long term is all the manufacturers of the equipment are going to have to put this in their software to view the image in their equipment. And when they do that, and you just hit mycotoxins, it's going to scan the most common algorithms, and it's going to light up and show you where it is. But that's going to take a while for that to happen. So right now, what I do, I get the CD, I go over the CD and find the images I'm interested in, and I send the CD to the company with the images I want them to look at on my document. They look at the images, and we get together on the computer, and he's showing me the images, and I'm telling him which ones I want, and then I shoot them with my phone.
This is for the AI?
Yeah, I shoot them with my phone, and then I put them in the chart. That's how I have to do it. But right now, I can't do any of it because they're in the middle of selling it, and the people who are helping me are not going to do it right now. Anyway, this is going to happen. It's just going to be slower than I'd like to see it.
Now, that was the next question. How do I order the CTAI? So that was the next question.
That's going to be probably, I don't know how many years it's going to take. If Elon Musk was doing it, it'd probably be next week. But, it's just political too. And it's all about people getting involved in it. I see these dollar signs, and instead of looking at the big picture, you want all the companies to have it, not one. You want it to be everywhere, just like the images are everywhere. So everybody understands it. Now, when you do this, just so you know, when it's in your urine, it's in your brain 100% of the time, but you don't see it. Seeing it is going to produce more compliance, I think. Well, I mean, who knows? People can see it in their brain now. They don't do anything different. But I would. If I saw it in my brain, I would get busy,
Dr.
Dennis?
Yes.
Hello?
Yeah,
yes.
Go ahead.
Oh, okay. I've been treating mold patients for about 10 years now, and mostly do very similar things to what you've discussed. I we had a lecture by Al Johnson. He's a DO in Houston, I think, or Dallas, and he's gotten really great success using hyperbaric oxygen therapy.
Oh yeah, I've used that before. Yeah,
and
that's
they get better much quicker than the amphotericin and mupirocin that I've been using. It takes 6 months to a year, my treatment, but with the hyperbaric therapy, they get better so much faster. I'm not
Yeah,
sure
I
what
agree.
the mechanism of action is, but
I agree. There's a guy down in New Orleans that does that. You know, he's kind of the father of it all. It's Paul Harsh. You know him?
No, I sure don't.
Harch. He started it all. What he did is he put the QEEG on their brain and figured out which combo, which pressure and which level work best with their brain. See, and that's a little bit more advanced, but it works better even.
Yeah, 1.4 to 2.5 atmospheres. I think you start low to lessen the Herxheimer reaction.
Yeah.
And then you increase it. And you need a full metal machine. The canvas machines don't get as high a pressure, but you can get a cognitive improvement with the canvas ones, though.
Yeah. Now, you know, you get dramatic. What you're doing is removing the mycotoxin from the brain, but remember, before they got in the brain, they're in the sinuses. So you don't want it to keep coming back. And remember, the sinuses have the spores in the sinus, and they're a manufacturing facility for more mycotoxins, even when they're out of it. So some of those patients, half of them are going to need their sinuses cleaned out to get a long-term result. Now, I'd say half maybe, but not more than that. You know, would benefit from surgery. But if you do the hyperbaric and they get well long-term, that's wonderful. They don't need the surgery. But if they keep relapsing, that's why. And they can't go back in their house, you know. You got to tell them. They got to be.
Thank you for your lecture tonight. It's very illuminating. Thank you.
You're welcome.
Dr. Alloy wants to know if you could show the ionizer again and talk a little bit more.
Yeah, let's go to that. I want to talk about that stuff because it's important. Can you see it?
Yep.
All right, so this is a fan, and this ionizer over here goes in it. And this thing is called a D6 stereonizer. It's from Israel. It's about, if you buy 100 of them, it's about $130 a piece. Otherwise, it's about $400 a piece. So what it does, you hook it up to the fan electrical system so that when the fan is on, it is on. And you do it inside the HVAC system or inside this fan here. This is a portable version. It makes 1 trillion ions per second. It'll fill up a room in just a few seconds, floor to ceiling, and it removes mold, mycotoxins, VOCs, viruses, and bacteria from the air with no hydroxyl and no ozone. This is probably the most important thing I told you, this thing right here. So, and then the two guys that I told you, let's see, to get it from. Okay, see these two phone numbers?
Yeah.
These two phone numbers, you can get this thing from, and they can come install it. They'll go to different states. It takes about 20 minutes to install it, or you can buy it and get a good HVAC person to put it in for you. But also you need a portable unit. But this ought to be on, it ought to be a mandate. If you have an HVAC system, that has to be on it, or you can't have an HVAC system. That's how good it is. It can't hurt you because it doesn't make ozone and hydroxyl. And when the fan's on, it's on. So it's filling up the room. Now, this thing is rated for 6,000 cubic feet a minute. So that's like a commercial fan on a huge office system. And on a home system, that's even better because your overkill is good in a house. And so it should be on every commercial system and every school everywhere. You would have much less fungus. It couldn't grow on the coil ever. And that's where it is most of the time. So
Okay.
these are the phone numbers to call to get that. And then these products, there's a company I started like 20 years ago called Microbalance Health, because there wasn't anything out there that wasn't toxic to people. So we made these candles you can stick in a room, and they'll remove the mold and mycotoxins from the air in about 2 hours in a 12 by 12 space. And so you can take them on a trip, you put it in your house. And this you put in the fogger, the solution, and you dilute it. And that's what we fog with. It's 4 citrus seed extracts, basically. And then this is the laundry additive. So the laundry additive is a little different. You just use your same detergent that you always use, and just put that in there with it. And it really gets rid of mold. And the key is getting rid of mycotoxins at the same time, not just the mold. So, and then this stuff here, this sinus defense 2.0 is a unique thing. A lot of these patients, they're immune suppressed. And so they're getting all the stuff that comes along. Strep, staph, diplococcus, pneumococcus, haemophilus, Lyme's, Epstein-Barr, cytomegalovirus, the 3 herpes, and the mycotoxins. All of those antibodies are in this bottle. See, I can say that to you, but I can't say it anywhere else. So the way we did this, we took and then vaccinated the cows with all that, pregnant cows, and then when they had the calf, we collect the colostrum, and then it's got transfer factor in it. The transfer factor works against all those things, and you can't hurt yourself with it. It's in alcohol. Some alcohol's in there, so you can't put it in your eye or anything. But you can spray it on your skin, but spray it on your tongue and spray your throat. Like if you start getting a sore throat, spray the throat where it's sore and it's gone right then. And then just when the flu comes along, just keep using it 3 or 4 times a day. Spray your throat with it, spray under your tongue. And if you use beta glucan, it amps it up 300% by increasing the white cell count. The white cells are what you're making the white cells come in, because these antibodies, transfer factor acts as an antibody and attaches to the organism. And then the beta glucan white cell can take it out. So these 2 are on that web page. And just keep these around all the time. It's like soap, it just works. So all these organisms are in it. These are the most common organisms, especially in chronic sinusitis. And it really helps Lyme's people. It's not the only answer for anything. It's just another thing to use to lower the load. It's all you're doing. And then this is the mold plate kits here. And this is the fogger. The fogger is unbelievable. It shoots it out 30 feet. And you don't put it down. You walk around with it and just fog everything. You can do a lot of stuff quickly with that. And then this is a little squirt bottle. You use distilled water. The salt packs are already in there, and you put citral drops in there instead of the SSKI. If they're really badly infected, I use SSKI. And this is a nose spray that's got a lot of antifungals in it. This is all stuff you can get over the counter on our webpage. And then this is what we use. We use to detox them. We use first of all, you got to use oxygen. 100% oxygen at about 8 liters a minute for 2 hours a day, or you can split it up, especially if you're doing something like walking or in a treadmill or something. It even works better. But if you start having trouble after 10 minutes, then that's your time. So you have to draw it back. But it's beta glucan, NAC, not beta glucan, glutathione, NAC, and a liver cleanse. Those 3, and then your probiotic, and then cellotropin is actually growth hormone in a bottle. So you just spray it under your tongue. So, and then this is the stuff I use with oxygen. If you don't use oxygen, you don't dilate the vessels, you can't get it out of the brain near as well. You just prove that with hyperbaric oxygen. So the next thing is that everybody could have is an oxygen concentrator. It's got to be 10 liter a minute machine. It can't be a 4 liter. And, prescribe that for them. Insurance won't pay for it. It's like $1,500 or something for that. And they'll use that every day and do all this stuff. Then if you go back, and look at the brain on MRI with AI, you can see the mycotoxins go away like I showed you when you're using oxygen. It doesn't work as well without oxygen. And then hyperbaric is awesome. Do that. But they've got to be out of it, or they're wasting their money. As soon as they finish and get cleared up, they'll go back home and get sick again. So just make sure they're in a safe place when you start hyperbaric so they don't waste their money. So then this is most of this. Yeah. So all these things are the basic stuff I use. Now we got training videos. If you can, when you click that, you have 15 training videos come up. If you just can shoot that with your phone. So this Dropbox here, that's a Dropbox page where you can see all my training and videos. I figured if I got hit by a truck, somebody needs to know this stuff. So I made 15 videos. So this is like the Dropbox video. Just shoot that with your phone so you can go to that site and look at those videos. They're real simple. I made them short so you wouldn't go to sleep.
So you don't have to be an ENT to do your techniques?
To do the surgery, you do, but all the other stuff that I just showed you, no, anybody can do that. Anybody can wash your nose out and put stuff in their nose with a nebulizer. That Rhino Sprint works better than a spray. So you can get any pharmacist to mix like the way I told you. Amphotericin is 3 milligrams per ounce of water. Voriconazole is 12.5 milligrams per ounce of water. So multiplied, if you want to, make 6 ounces, just do the math, and just tell the pharmacist how much you wanted to put in there, and then you can irrigate with it, or I put it in that nebulizer after they irrigate. You want them to clean their nose out first and then nebulize. Don't nebulize on top of all the snot, You clean the nose first and nebulize goes in better. So this is just really easy stuff. Anybody can do this, and then get them on some antifungals. And oxygen is a big deal. And hyperbaric, you can do a lot of good, but hammer them with the environment. Just hammer them. Everybody thinks they can do all the stuff you tell them to do and go get the hyperbaric and they're going to be fine. They're not going to be fine if they still go back to a bad house. They just waste all their money. They'll be sick in another day, because they can't dump it. You can't fix that.
Dr. Bill, can I go to questions?
Yeah, that's what it's going to do next.
Sure.
Go ahead. Go for it.
All right, Dr. Dennis, that was a great presentation. You should have your own protocol scheme like Shoemaker and Campbell too, from the sound of it. You put a lot of work in this.
Shoemaker, I think, I don't disagree with a lot of stuff he says. Some of the stuff in my world is incorrect, and a lot of it's correct. But that's about all I have to say about that. What I do, I know it works. And what I do that they don't do is I'm able to go into the nose and remove some of the causative spores so they stop making mycotoxins. And that's key in some of these patients, or you can't get them better.
Well, since you mentioned that, do you also, there's a lot of talk about Marcons. Have you heard of this?
Let's talk about that. I'm glad you brought that up. So there are 3 things that are always taught: Marcons, mast cell activation syndrome, and the biofilm. Those 3 things are the same thing, caused by the same thing. It's all fungus. Now, if you get rid of the fungus, all those things are treated and go away. Now, Marcons only, or any bacteria that you find in the nose with a culture, only needs to be treated if you're having purulence. If you're not having any purulent drainage, you don't need to treat it. Why? Because who has staph in the nose? Everyone that's breathing. Okay, okay. It's part of the normal flora. So it's like saying, you know, Miss Jones, you have E. coli in your stew. We have had emergency bug spray for your rectum. You know, that's what this is like. So it's all BS unless they're infected. And bug spray has never gotten anybody well long-term from any nasal infection of Marcons. Never, not even one. As soon as you stop using it, it's back. Why? Because the fungus is still there, making pits in the lining, destroying the cilia, so you can't move the mucus out, so they stay infected. So you got to treat the cause, which is the fungus.
So that's a common spray that's being used in the Shoemaker protocol.
That's right.
And another one that they use in the protocol is silver with EDTA. Do you have any background with that?
Yeah, now they're trying to break up the biofilm, but remember, why is the biofilm there? The biofilm is there because the immune reaction to fungus causes pits in the lining, which become a lab upon which to build the biofilm. So if you don't have the pits, you can't have the biofilm, and you don't have you don't get the infections because the cilia move it out. So if you focus on getting rid of the fungus in the nose, you have a longer term result than with bug spray. They're treating the surface and not the cause. They're treating a result of the fungus. You understand?
Right. So you're saying they should be done in combination. First, kill the fungus and then use the other ones next. Is that correct?
Well, on that slide I showed you where it was all white in there, all I used was amphotericin. Once I killed the fungus, I didn't have any problem with the bacteria. But I'm not saying you shouldn't use an antibacterial. If they have purulence, you should treat it. That's right. You should treat it. And bug spray is fine to treat it with that. But you're never going to get it well long term because you haven't addressed the fungus. It's going to keep coming back.
Well, as the recent talks have been transpiring, bug spray has suddenly now become a lot of organisms becomes resistant to it just because of the tremendous use of bug spray in the past.
Well, not only that, it's because you still have paralyzed cilia and pits that are full of purulent mucus that are going to get infected by whatever's living there. And you're not going to ever kill everything. So if you kill one group, another group's going to grow. You know.
Right.
So the key is you must train yourself to treat the cause of the problem. The cause is fungus. If you don't get the environment straight, I don't care what you do, you're not going to ever get them well long term. You'll get them well for 10 minutes, and you're just going to have to keep giving them stuff. But you want to get them well long term, right?
Right. So you're mentioning about treatments. Some questions here about do you use itraconazole intranasal? You've been talking about it about oral, but do you use it intranasal also?
Sure, you can use it intranasal. Yeah. So just like I use voriconazole. I like it better because it goes in the brain better. Nasally, it's very similar to itraconazole. But yeah, we use 12.5 milligrams.
Well, you 12.5 milligrams, you said?
Yeah. Yeah, it's great in the nose.
So you mentioned about amphotericin as a nasal spray. Do you go as far as doing amphotericin B oral?
Yeah, you can do 250 milligram, 250 milligram capsules twice a day. It's not absorbed in the gut, so you won't hurt them with that. Now, IV would have killed them because, you know, it knocked their kidneys out at that dose. But orally, it won't. It's not absorbed in the gut.
Thus, less kidney damage, is that what we're saying? When you do oral?
Zero, because it's not absorbed in the gut.
Ah, okay.
So amphotericin, that most doctors don't know that. So if you take amphotericin IV at 50 milligrams 3 times a day, you'll cure a lot of people, but you're going to kill some of them because you knock their kidneys out.
Mm-hmm.
All right, so IV is when it's dangerous. Orally in a capsule is not. You want it to stay in the gut,
Mm-hmm.
and you want to wipe out all the yeast. You're not trying to get it systemically. If you want a
Yeah,
systemic
good thing you
drug,
mentioned that because I was
you
thinking
use
of the renal
voriconazole
toxicity.
or itraconazole. You know,
Mhm.
don't use amphotericin for a systemic drug, or you know,
Right.
try to make it absorbable by putting liposomes or something. You'll kill somebody doing that. So you want it to stay in the gut to treat yeast. So use a capsule of it. Most
You
pharmacies
you
know how to do it.
yeah, you're mentioning about the assessment. Like most of your presentation focused on assessing the sinuses. Do you have
Right.
any blood work recommendations for pain, like pre or even post that you keep an eye out for in terms of treatment response?
Uh, well, I like to follow the hormones. I like to do cultures, and you know, it's good to get some immune workup to see which organisms are there then, and then physiologic workups, whatever you like to track that goes along with fungus. But see, I've got the advantages. I can take a scope and look in the nose and tell what's going on. Uh, Sometimes better than a blood test can. And so I'm not against any blood test. If a blood test helps you, do it. But I don't use them that much in my practice. I'm imaging and I'm watching, and then we do allergy testing and that kind of thing, and the routine blood work. But we don't do you know, and the antibody levels that they have in their system to different things. We do all that, but I don't do any of the long physiologic workups. I don't even know how to read that stuff.
Right.
So,
Too
so,
too complicated. Huh?
yeah,
One of the things I think questions here was your case of the Parkinson's.
yeah.
They were asking if you both targeted the sinus along with systemic therapy for your mold, or it was just at all sinus therapy that you did for the Parkinson's patient.
Now both of those patients already had good neurologists, but they weren't moving the ball because they were so inundated by their environmental load that they couldn't get better. There was too much mycotoxin in their, destroying their brain. And so they would get short periods of improvement. As soon as the medicine was gone, they would be back to the original. So when I removed the mold spores and mycotoxins from the sinuses, and they had their air right, they moved out and had their air right, then they got a really good result from the surgery. They got a lot better after the surgery, but their neurological medicine actually worked because the stuff was out of their brain. You see, the mycotoxins was out of their brain. So that's why it works so well.
Right.
We in other words, remove the cause of the Parkinson's, which in these cases were mycotoxins.
All
Now,
right. Well,
everybody that has
yeah.
Parkinson's, it's not mycotoxins, there's other things too, but in those patients, that's what was wrong with them.
Right. Well, definitely this is a different and very unique approach to mold therapy. And this adds to the growing list. And as I think other practitioners agree here in the call, that we have been combining specific protocols in relation to mold therapy, and some might be sticking with their own protocol, like just a plain shoemaker or a Campbell protocol. But I think the key here is opening ourselves up to these different protocols that we can combine and mix, and hopefully can help the patient, which is the
That's
most
right.
important thing at the end of the day.
I don't think anything's right or wrong. Whatever works is okay. But you got to always think about, am I removing why this patient's sick so my medicine can work better? That's what, if you know it's mold, you got to get involved environmentally, and you got to kill the fungus. That's the first step. And then removing the toxins is, they come in through the nose. So the highest concentration is in the sinuses. So if you don't address the sinuses, you're not going to get anywhere, because they'll set up camp there, and they're churning out a manufacturing facility after they're in a clean environment with all the mold spores in their sinuses. So a CT scan is very helpful and telling you how much infection they have in their sinuses. If they've got a lot in there, then you have to address it. So if you're doing everything you can do and they're in a good environment and they're not moving the needle, you got to check their sinuses because that's where it's hiding out.
Well, great work, Dr. Dennis. Thank you so much. You got all my questions X'd out.
You're welcome.
Hey, thank you, Dr. Dennis. Great as always. Thank you for coming back. I don't know if you remember us from a couple of years ago, but you filled in some of the holes for us again. And
I'll keep filling in holes. You learn something every day if you stay awake.
That we do. Speaking of learning something every day, Dr. Naria, what are you learning from Andrew Weil?
I told you, don't be cycling for too long. It will kill your peroneal nerves to give you chronic sexual dysfunction. That was an eye-opener for me.
You had to go all the way to University of Arizona to I think most of us already knew this, didn't we?
I didn't. I was planning to be the next Lance Armstrong, so much for that dream.
Well, you're going to be blood doping. Is that what you're going to be doing?
So give me the atmosphere. Give me the atmospheres for the hyperbaric again. 1.4 to 2.5. Is that right?
I think he said 2.5 ATMs for hard shell. He was promoting more hard shell than soft shell. And then you increase it as you move along.
Okay. Yeah. So
that's from Dr. Bailey. I think.
Okay. Well, I've got several patients that did hyperbaric and all of them got better. So I think that's a really important thing. I got a kid that, he was a real bright kid. He's like 17, 18, going to college already, but he just sit in the chair with his head down like this and just totally whacked out. He couldn't function. And they got out of the house. I operated on him, did all this stuff. He got better. But then they got the hyperbaric and he's back. He is unbelievable now. The hyperbaric was the cherry on the pie. He really needed that. And that's how I know it works so well, because I got him to a certain extent, but I couldn't get him any further. The hyperbaric removed all that you couldn't do with all this other stuff. So it ought to be kind of on the front end, but you're going to put some pressure on the kidneys when you do that. So you gotta not go crazy and knock the kidneys. You could really hurt the kidneys, I think, if you did too much too fast. Because you're mobilizing, it's coming out, but it's going to come out through the kidneys.
Okay. All right. Thank you so much. Anybody else have any comments, questions?
I enjoy teaching. I guess you can tell that, but I'll talk to you all day. But what I'm doing works, and if it helps anybody, great. I know that what I told you to do is going to be helpful for you. If you can just focus on getting the air right and getting after the nose, clean the nose out really good. Have them do it twice a day. Wash out and then nebulize with your antifungals. If I can leave you with that, that will help whatever you're doing, because it comes in through the nose and exits through the urine. So where is it? Everywhere, right? So
okay, all right. And with that, Dr. Burgess, I see you're on. How are you doing?
Thank you. I'm doing good. Thank you, Dr. Dennis. Very useful info. Appreciate it.
Let me see. Where are you?
I'm blacked out.
Okay.
Because I'm naked at home.
Okay.
I'm the guy holding the moon.
It was our big chance. And it must be cold in Las Vegas. Dr. Quinn has a shirt on. So
oh, it's cold.
I have a question.
Yeah.
I had a mold mitigation done after a flood in a building I have. They used high heat after they did everything else. Tore out all the insulation and did all the stuff that they did, but then they used really high heat for a couple of days. Does that do any good? I hope.
Heat's not a bad thing. The thing is, if you got to do, where was the flood from?
The upstairs toilet overflowed.
Okay.
Went down through the ceiling and down, through all the walls, and we
All
had
right,
to
so
rip a
now,
lot of stuff out.
so now all they need is one paper towel in the toilet and you got to do the whole thing again,
I know.
right? All right, so
This
the
was
reason I'm saying that is because this happened to my office years ago. Here's what you got to do when something like that happens. There are sensors that are not expensive that you put on the floor, and they're wired ones. They're not battery operated because nobody's going to change the batteries. And they go to a solenoid switch that turns the water off to the whole region, that whole area automatically. Because if a pipe breaks at night, you're totally screwed. Your whole place is flooded.
Right.
And then as soon as water hits it, it turns it off and you get minimal damage. And so that needs to happen in every building. It's not that expensive either. It's very simple. So do that first, and then everything that got wet has to come out. All the wall, sheetrock, all that stuff's got to come out. Sometimes the floor's got to come out unless it's concrete.
It's
you got to do that first. Then you dry it out. I don't care how they dry it. Then you dry it out before you build back.
Yeah.
And but I would have. Is that your place you're talking about?
It's not my house. It's another building I have was a little store with an apartment on top.
Okay, so you own it? You own.
Yes.
Okay, so just on all the water supplies to the different apartments, just do that to everything and have the central water supply turned off. It won't cost a lot of money. The neat thing is you get an insurance deduction when you do that, because the chief thing they have water damage is number one in insurance claims, more than fire.
$25,000.
Yeah, more than fire. So
25.
So you want to do that and report to your insurance company, and then they'll lower your rate, and you'll pay for doing it. I mean, you don't want to worry with this, because somebody unknowingly, or they just don't have good sense, is going to stuff a paper towel in there, and then you're going to do the whole thing over again.
Well, this is lime that jammed up the works in the toilet, and they didn't hear it. So
yeah.
But I think they didn't go far enough. The insurance company stopped them on the ceiling and the furthest wall, and I'm kind of concerned about that.
Well, you're right. You have all that has to come out. I guess the easiest way to do that is to have somebody, some mole person with a brain, and that's kind of hard to define. But if you got a mole person that's really good to cut out a square.
The mold people wanted to keep going. The insurance company stopped them, but
they can't stop them if they'll take a window out of the sheetrock and show that there's water damage and fungus in there. Then see, they don't want them to look. If you just take the little windows out so you can look and prove it's a problem, then they got to pay for it.
Right.
That's how you get around that.
But the heat should have taken care of the part
the part that you open, but it won't. You mean shoving it down the cavity? It might dry it out, but you're drying out.
Outside wall might.
What?
It was an outside wall, but I noticed that after it was painted, it seemed like it puffed up a little bit, and I wondered if.
Okay, that's all you gotta say. If it's puffing up, it's leaking still. So that means there's water underneath trying to come out. So you got to take that sheetrock off and look inside.
Okay.
And you don't have to make a big deal out of it. You just get somebody with a brain to cut a square out and look in, and then you can take pictures and do cultures and everything, and then they'll have to pay for it.
Okay.
Doc, one question. Have you considered using intranasal cyclodextrin with itraconazole?
What's cyclodextrin?
Okay, that's something we talk about in these groups a lot. It's a compound that we're using to deliver various medicines. It seems to have some properties for mycotoxins as well, and is a very useful delivery system.
I haven't tried that. You can try it. See, you want to make sure it doesn't interfere with the chemical.
Right.
with a, and I don't have a clue. The only way you could do it, you could put some in a petri dish, petri dish full of fungus, and then put the antifungal in there,
Yeah.
and then on the other side put the antifungal mixed with the dextrin stuff you're talking about, and see if it works just as well.
That's
how
great.
you.
I like that idea. I'm gonna start using those. You use a simple agar plate. What do you get it from McKesson or somewhere?
It's called SDA, Saboral dextrose agar, SDA agar. Very common. You can order it on that website. They have them on the website.
All right, I'll get some.
And then you just get a known area that's kind of moldy, and you just streak a Q-tip with mold all over it.
Yeah.
On the plate, and it starts growing, and then you put your stuff in there, and you can see what works and what doesn't. You can put the medicine in there first, and then put the mold on top, and you can see where the mold grows and where it doesn't grow. And see if there's a difference between the mixture and between the antifungal alone. You just don't want to turn off the antifungal inadvertently,
Right. Good.
And what's the value in it? What's it do for you?
Halassa, if he were here, he could explain it better than I, but it seems to be a very potent carrier molecule of all pharmaceuticals. A lot of pharmaceutical companies are using it as a more effective carrier.
Okay. Well, if it makes it, also you can figure out if it works better. Do a spray with it and without it, and see which one works the better. Clinically, you'll get a feel for it, but it'd be nice to put some in a little spray bottle, both ways, straight and mixed, and then spray it on some mold, in a plate.
Yeah.
And see if there's any difference.
All right. I'll do it.
And then let me know. I'll give you my email. It's drddennis@gmail. It's hard to remember.
All right.
3 Ds. Yeah, if I let me know, just send me the pictures and see. Be kind of fun.
Yeah.
So we're probably a few years away from seeing this stuff go big time, but you better have a really good environmental team ready when this imaging comes out, because you're going to really need some help getting the environment right. And there's so much wrong being done. I think it's probably equal wrong and right. And then there's wasting a lot of money, and it's incorrect. It's just pitiful. And they stay sick, and then their wallet's empty, and they spent their last dime and they're still sick, and they can't live in the house. I see that all the time. That's why we got this. The two numbers I told you is the two companies I use that I've trained to do what I need them to do. Plus, they were already mold trained, but they're really good to do the HVAC stuff too. HVAC's key. If you don't get that right, you're not going to get anywhere. Cleaning up the mold and fixing it, taking the walls out, anybody can do that part. It's the fiberglass issue, and the HVAC system has to be done right in a situation like that. And very few people know how to do that.
Okay.
All right.
All right. Okay. Thank you, Dr. Dennis. It was great.
I enjoyed it. Thank you for having me on.
Appreciate having you here. Okay, everybody. Next week we have Al Sanchez is going to be talking to us about poly-MVA, which I don't know anything about, but Dr. Nario is an expert. So
it's for cancer. They use it for cancer, mitochondrial regeneration. So yeah, it's a good supplement that's out there.
Okay, great. Okay. Any comments, questions? I'll if not, we'll wrap it up, and we'll see you again next week. Okay, thank you, Dr. Dennis.
Thank you very much.
Thank you, Dr. Dennis.
Good night.